Thank you. There was a great deal of information in the governor's news conference this afternoon, but one major point he addressed was this. The coronavirus is a concern for all people, but data is showing the virus is hitting blacks particularly hard. He pointed out some of the risk factors for the virus include living in close quarters with others, having underlying health issues, and a lack of access to health care. Channel 3 Eyewitness reporter Mike Savino is here now with a look at the numbers.
The numbers are staggering.
There are concerns that the coronavirus is going to be particularly deadly among African Americans, fueled by what some people say are longstanding problems that make them vulnerable. A new study by doctors at UConn Health Center finds African Americans have been far more likely to catch and die from the COVID-19.
And I found, and we find this in a number of different states right now, that there was not really good reporting of the data.
About 12% of Connecticut residents are black. But through Wednesday, African Americans accounted for 16% of deaths and 17% of positive tests in cases where race is known. UConn Health Center Dr. Cato Lawrenson says more data is needed to fully track the issue. Lawmakers also want more data from the Department of Public Health. A letter from more than 24 Democrats saying, "We know that this pandemic will hit communities hardest that are more densely populated, generally have worse health outcomes, and experience the types of persistent disparity that will almost certainly mean that the impact is disproportionate inside them."
These have long been issues that have impacted our communities, and we just see them exploding to levels that are just really terrifying.
Experts and local officials say the data really just highlights disparities that have already existed. Diabetes, asthma, and other conditions associated with more serious coronavirus cases are more prevalent among African Americans. African Americans are also more likely to live in urban areas where social distancing is harder, and many have less access to necessary health care. Black lawmakers hope that this sparks a long-term conversation, but they say steps need to be taken to address the issues right now.
That's going to be the only way that we're going to be able to flatten the curve and ultimately get rid of COVID here in Connecticut.
That was Mike Savino reporting. Now, it's pretty clear that coronavirus is going to affect our lives for weeks and months to come. So now, some